Thank you, Madam Speaker. The Honourable Prime Minister, the Honourable Leader of Opposition, Honourable Members of Parliament, Honourable Cabinet Ministers, our visitors in the gallery, Ms. Amula Vinaka, and a very good morning to you all. Madam Speaker, at the outset I'd like to thank and congratulate His Excellency for demonstrating a consistent and unwavering faith in Fiji and in our ability to offer our people the best we can, even despite the recent challenges brought by the aftermath of Cyclone Winston. I also applaud that he has chosen to use his position to advocate on an issue that affects far too many Fijians, and that is the prevalence of NCDs in the country. Madam Speaker, His Excellency's call to the members of this House to support democracy, to think beyond our parochial interests, whatever they may be based on, to join hands together, to grow our economy, and to think seriously about the society we build for our children and those to follow was exactly what we needed to hear. This is the message that will shape the legacy we leave behind for the next generation. And I think it is the message that will drive the reforms and strategic rethinking that I plan to bring to this ministry. Madam Speaker, may I also say how honoured I am to take on this new portfolio. My predecessor, Honourable Chonyo Samate, has set standards that I will strive to meet every day. And I'd also like to thank him for the energy and dedication that he brought to his role. As the new Minister for Health and Medical Services, I say to this august House that I am committed to serve my fellow Fijians to the best of my ability. Madam Speaker, the Ministry of Health and Medical Services will be embarking on a new plan of action that puts access to quality health care at the centre of every decision we make or we are going to make. The Fijian people need to know where they can go to receive treatment, when they can go, and what services our doctors and nurses are capable of providing. People's lives are dependent on access to this information, and by making this information readily available, we give our people the tools that they need to be proactive about their health and remain as productive members of our society. Madam Speaker, currently we have 3 major divisional hospitals operating, one in each, with one in Central, Western and Northern Division. We also have sub-divisional hospitals established throughout the country, with 5 in the Central Division, 5 in the Eastern Division, 6 in the Western Division, and 3 in the Northern Division. Currently, there are only 2 specialized hospitals in the country, both in the Central Division. And our divisional and sub-divisional hospitals currently offer 24 hours emergency care. Madam Speaker, we do, however, have a high number of health centers and nursing stations spread throughout the country. 98 nursing stations and 84 health centers. So it is vital that we build the capacity of our nurses to provide specialized care so they can better serve their own often isolated regions. The Ministry embarked on a nursing specialization program over the past several years that sent our nurses overseas for attachments in specialized areas, including emergency nursing, pediatric nursing, intensive care nursing, coronary care nursing, oncology nursing, psychiatric nursing, advanced midwifery and other related areas to population health. Madam Speaker, these nurses have performed extremely well and have brought knowledge and expertise back to Fiji that they can pass on to their counterparts. The challenge we now face is how properly to recognize and reward these nurses based on their qualification. We are currently working with the Ministry of Civil Service to develop the remuneration package and structures that we need to recruit and retain top talent in the country. Madam Speaker, we are also taking serious measures to make sure service offerings are expanded at these locations and that chronic issues affecting health service delivery are addressed. There is no accurate measurement of just how satisfying access to high-quality health care can be for our ordinary people. So we must be unrelenting, and I repeat, we must be unrelenting in our own efforts to give every Fijian the knowledge that they should have, that they should ever need in terms of quality health care and where it's available. I'm sure you'll agree with me, we need to keep our hospitals clean. We need to cultivate friendly, professional attitudes among healthcare providers, and we need to instill a sense of compassion and empathy for those in our society who suffer from effects of ill health. We have begun working with the Fiji College of Medical Practitioners and the Fiji Medical Association to reduce the long patient waiting queues in public hospitals. These lengthy queues, Madam Speaker, at most of the times can serve as a deterrent for people who may otherwise be proactive about the health issues, so we need to assure our people that the health concerns will be addressed in a timely manner. We have confirmed there will be a pooling of locum doctors, these doctors who can fill in during busy periods to help remedy the doctor shortages we currently face. This means shorter queues and more opportunities for our Fijians to seek treatment when they need it. A locum arrangement with Nandi Hospital is currently underway, and others will start up around the country on the basis of need. Madam Speaker, this locum arrangement will bring in general practitioners to support our health sector in critical areas. It is an immediate fix to the service delivery issues that we face until we are able to staff our own hospitals appropriately. And we are allocating substantial resources and effort towards recruiting doctors from overseas to fill in both the clinical and public health areas gap. We are also currently working with the Ministry of Civil Service to fill those gaps, and so far have approved 879 new positions for medical superintendents, consultants, chief, principal and senior medical officers, and medical interns and assistants. So far we have filled 553 of these positions, and we will continue to seek qualified professionals for the remaining 326 spots. These new recruitments, Madam Speaker, the efforts come on top of our recent pay rise ranging from 56 to 81% for our doctors, which has made major strides in increasing job security and satisfaction, and also has given our doctors the professional recognition that they deserve. Madam Speaker, His Excellency in his address also highlighted the need to engage with and care for our younger generation. To that aim, the review of the peer educator program is in motion now, so that Fiji can have in place a program better designed to confront the social health issues affecting our young people. The Ministry will establish youth-friendly health centres at the divisional and district levels to give our young people greater access to the services and information that they need. Madam Speaker, the Ministry of Health and Medical Services, through its Public Health Division, recognises the importance of holistic, integrated approach to a child's learning as well. To educate our children at an early age about the benefits of healthy living and the importance of caring for the environment is definitely a right step in the right direction. Madam Speaker, equal access to health care is a fundamental human right as enshrined in our Constitution, and also a key tool in building the resilience of our families and communities. This is the key undertaking of the Ministry and the founding principle behind the Free Medicine Initiative. Last year, the government compiled a list of 142 medicines to make freely available to eligible members of the public by the end of September. A total of 16,992 registrations were made, and a total of 23,925 free medicine cards were created and have been distributed to date. Madam Speaker, His Excellency discussed the upcoming review of health laws in the 2016 Parliament sessions. We fully support this review and believe that it will make a big difference, a huge difference, in improving public health security. The Public Health Protection Bill and the Quarantine Bill will modernise Fiji's legislations and align them to international best practices and give us more resources to respond to the health challenges faced by our people. Madam Speaker, the modernisation of our health legislation will also give my ministry a vast array of new tools to respond to new health threats and will boost public health protections in the immediate and long term. These include protections from communicable and other diseases, environmental risks and injuries. Madam Speaker, the growing epidemic of non-communicable diseases is undoubtedly one of the major challenges confronting our health system today. We must acknowledge that each one of us plays a vital role in protecting and promoting our own health and the health of our families and our loved ones. NCDs are a challenge that can be successfully mitigated if each one of us takes responsibility for eating well, exercising, and avoiding smoking and alcohol. Data from US-based Institute for Medical Health Metrics and Evaluation tells us that about 18% of the burden of diseases in Fiji is attributed to dietary factors, with around 7% being due to tobacco and 5% to low physical activity. To put it simply, Madam Speaker, these three causes taken together account for almost a third of the ill health that affects our country. Each one of us, through our own actions, can help to reduce the pressures on our country's health budget and at the same time enjoy better, healthier and longer lives. 80% of the activities, Madam Speaker, and choices that shape individual behaviour of our health occurs outside the doctor's office. So we need to support healthy decision-making where our people can live, walk, learn and play healthy. It is about promoting health attitudes, getting our people educated on the benefits of physical fitness and working alongside our other ministries to encourage people to get moving. Madam Speaker, I am extremely proud to have been given the opportunity to lead the work of the ministry that does so much to improve the lives of our fellow Fijians. And I intend to play my own part in honouring the Prime Minister's pledge that we will leave no one behind in the new Fiji. I look forward to working alongside all of you, all the members in the House, the public and all our stakeholders in advancing our health sector and ensuring that all of our people can live fulfilling lives and have access to medical services and information that they need to keep themselves healthy and happy. Madam Speaker, with these words, I commend His Excellency's address to this august House. Thank you.